everybody, this is Tess with ROE Dental Lab, and today I want to talk with you about patients who love their dentures and don't want to replace them. We see it all the time chairside where the patients have old dentures that even if they're a little bit too worn in the posterior or don't exactly fit perfectly or like they used to, they want to hold on to them and they never want to replace them. And sometimes if we try replacing them, it doesn't always work. And today I want to talk with you about some really cool workflows we have that breaks the mold, if you will, for taking on those cases. Let's talk through a few scenarios, I suppose. Let's say a patient comes into your office with an old denture. They love the fit, but the teeth are really worn down. We've all seen it where it's worn through the white part of the teeth to the base acrylic, and they're just really not able to use those teeth properly like they should be. What we can do at ROE is copy that same fit that they know and love and add to the posterior teeth. Now, how do we do this, or what kind of records do we need for scenario one? So what we'll need is a 360 intraoral scan with your intraoral scanner of the patient's existing denture. We actually have a really great YouTube video on it where we cover technique because sometimes it can be a little bit tricky. We also need an opposing and a bite. And the reasons we need those things is for when our denture technicians are designing the patient's new bite pattern and new setup, we need to know exactly how much room we have or how much room we plan on opening the patient, which are details you can let us know too. Option two would be the patient presents to you with, let's say, a denture that wasn't immediate at one time that didn't get realigned and they've had since. The teeth aren't super worn, but the fit's close, it's just not quite on. What you can do from there is actually take a wash impression inside their existing denture, take a 360 scan of that denture, following our YouTube video if you'd like, and submit that to ROE. If we aren't making changes to the teeth, we don't need an opposing and a bite, which is even less steps for you guys. So just a 360 scan of the patient's denture with that wash impression, and in both of those scenarios, the patient's denture is gonna come back to you as a final printed denture. And as crazy as it sounds, it gets even better than that. When we fabricate a final impact denture, we keep a file of the patient's final denture design, meaning in 5 years or 3 years, or if their dog Fluffy gets a hold of the denture, we know all these odd things happen to dentures. You can call ROE to reorder and we're gonna print them an exact duplicate of the denture duplicate we made they knew and loved. For me, chairside, I saw cases like this quite often where it was so tricky to try to duplicate their old existing denture and have them leaving happy with the denture and feeling like it was just like their old one but better. And it's so often that those patients don't always leave on a good note and end up falling back to their old denture. So this workflow has just been a complete game changer for doctors looking to duplicate or make their patient a new denture based on their old one with a few modifications. The workflow sounds too good to be true, but the good news is, if this video wasn't enough details, we have an awesome digital denture ebook on our website you can download for free. Or if you'd like to call in and just talk through some of the details with one of our technical support specialists, you can call into ROE and ask for some of their guidance, tips, and tricks to get your first case started. Please feel free to follow us on social media for the latest and greatest updates. Thank you for tuning in, and we look forward to making denture duplication a treat, not a trick for you.